We all know that women have a much more important role in making babies and, of course, in parenting as well. But that doesn't mean that the role of a man is zero. And this is a big problem, especially when the man's sperm count is zero, because if his sperm count is zero, how will he get his wife pregnant? There was a time in the past, about 50 years ago, when we'd say, sorry, your sperm count zero, there's very little which we can do about it. But today, technology has improved dramatically, and there is a lot which we can do depending on what the reason for the zero sperm count is. So let's start with some basics. Remember that a zero sperm count is called azoospermia. And there could basically be two important groups of reasons for the azoospermia. One is where the testis is producing sperms properly, but the passageway is blocked, as a result of which the sperms cannot come out in the semen, but they're still being produced in the testis. And the second group is what is called testicular failure, where the testes themselves are not producing sperms properly. And if the testes aren't producing sperm properly, that's a complicated problem. Let's first talk about the men with obstructive azoospermia, where it's a block. In the past, we would try to do surgery to bypass the block so that the sperms would enter from the testis into the passageway and then come out in the ejaculate. But often the results for surgery weren't very good. It's not like just calling in a plumber and bypassing a blocked tube. As a result of which, for a lot of these men, a far better option is called a PESA ICSI, which is a fancy word for Percutaneous Epididymal Sperm Aspiration with ICSI. Mouthful, isn't it? But it's actually quite simple. What that means is we stick a needle in, that's why it's called percutaneous. We take out the sperm, that's why it's called sperm aspiration. Aspiration is just a fancy medical word for sucking. And because we take it out from the epididymis, which is the little tubular structure on top of the head of the testis, it's called a PESA. Of course, when you use fancy terms, doctors can charge a lot more money from patients. If you just say, hey, we suck out the sperm from the epididymis and use them for IVF, patients might not be so willing to pay so much money. But jokes apart. So with these sperms, we can now use these sperms for what is called ICSI, which is a more advanced form of IVF because these sperms by themselves cannot fertilize the eggs. But we can inject a single sperm inside the egg and fertilize it. So we can use these sperms either from the epididymis or from the testis. Now let's look at the second group, which is a little more complicated. These are the men with testicular failure. And what's interesting is these men fall into two groups: complete testicular failure and partial testicular failure. Now, some of them have no idea that they have testicular failure because there are two compartments in the testis. One which produces the male hormone, the testosterone, as a result of which their secondary sexual characteristics, their beard growth, their libido, all that is fine. But the compartment which produces sperms is being damaged, as a result of which there is no sperm production in the testis. Sometimes this is partial, which means there are occasional areas of sperm production, but sometimes this is complete, which means no area in the testis producing sperms. There is no way of making this diagnosis without actually doing a testicular biopsy, which is something which men don't often understand, and definitely a lot of doctors don't. So they will do all these tests like FSH levels and ultrasound scans, but these will not provide the definitive information. So that for these men, we need to do multiple testicular biopsies, and if we find sperms, that's great news because we can use those testicular sperm for doing ICSI. If we don't find sperm, then we have to be brutally honest with these men and tell them, I'm sorry, you have complete testicular failure. And just like the only treatment for men with kidney failure is a kidney transplant, the only treatment option for these men would be using donor sperm or adopting a baby, which is a difficult choice, but something which they need to decide for themselves. So, what's the good news? The good news is that just because your sperm count is zero doesn't mean you can't have a baby. You need to find a specialist doctor who will do an evaluation, who will determine what the reason for the azoospermia is, and will then offer you the treatment options so you can have a baby irrespective of what your sperm count is. I hope this was helpful, and as an IVF doctor, I take pride in sharing my knowledge with IVF patients to help you get the best possible medical care. If you have any questions, please feel free to email us and we'll be happy to create a video to answer your questions.